Okay, hi all. Welcome to this session. I'm Ed, and I'm an academic researcher based at the University of Cambridge, and I'm also one of the co-conveners of the Social Power and Mental Health Conference, and I'm going to be chairing today's event. Okay, so now I'm going to ask our speakers to introduce themselves and give a brief verbal description. There are going to be 3 speakers in today's session. So our first speaker is Nadia Mbonde, and I'm going to pass over to Nadia now.
Hello, everyone. My name is Nadia Mbonde, and I'm calling in from Brooklyn, New York. I'm a PhD student in sociocultural anthropology at NYU.
Thank you very much, Nadia. And now I'm going to hand over to Lois Liao.
Hi, I'm Lois Liao. I'm currently a fellow at London School of Economics and Political Science, and my research is intersection between sociology, psychology, and economics.
Thank you, Lois. Now I'm going to pass over to Dr. Joy Rooney.
Hello, I'm Joy. I'm a service user and carer researcher of the Impact Group of Service User and Carers at the University of Worcester.
Thank you, Joy. And last but by no means least, I'd like to hand over to Peter Unwin.
Hi, my name is Peter Unwin. I'm a principal lecturer in social work at the University of Worcester, and I facilitate the Impact Service User and Carer group there. Hi.
Okay, thanks very much, Peter. And now it is time for our first talk. Before that, I just want to give a very brief content warning for all of the talks. There will be references to mental illness and mental distress throughout, and there may also be references to other potentially distressing issues. So for those of you who are joining from the UK, a list of organisations that you can contact in the event that you do need some support can be found at the BBC Action Line website. So I'm just putting that link into the chat now. Right, so without further ado, I'd like to introduce Nadia Mbonde, and Nadia's title for her talk is Visions of Black Futurity, the Politics of Self and Community Care at the Intersection of the Double Pandemic of COVID-19 and Police Brutality. So over to you, Nadia.
Thank you so much. Hello, everyone. I am very honored to be here, and I just want to thank the organizers of this conference, Ed for chairing, and my co-panelists for being here in dialogue with me today. As I said, I'm calling in from New York, so if you're hearing some background street noise, I apologize. So to begin, as a member of NYU's Disability in Equity in the Time of COVID research team during the summer of 2020, I had the opportunity to conduct 7 virtual and in-person socially distanced interviews with Black people in New York metro area living with mental illness to investigate how they were navigating the COVID-19 pandemic. In this presentation, I will discuss a sample of my interlocutors' experiences using pseudonyms and concealing other identifying information to protect their privacy. I will first begin with a post-pandemic aspiration from one of my interlocutors. Willow, an Afro-Puerto Rican young woman in her 20s, aspires for the world to be a more accepting and inclusive place to live with mental illness. She believes the collective experience of isolation during the pandemic may help realize her vision. When I ask Willow if quarantine has helped reduce the stigma of mental illness, she responds, I think it will, because now we have something to compare it to. When we're talking about having a hard time or feelings of not being able to escape ourselves, we can say, well, how was your quarantine like during that lockdown when no one could do anything? That's how it feels to me on a constant basis. And that comparison, I think, helps people understand better, and hopefully it makes them care more. I don't know if it will, but I hope so. Willow's words depict one of the many visions of Black futurity I will present as I discuss the politics of self and community care at the intersection of the double pandemic of COVID-19 and police brutality. During each of the interviews, it was impossible for participants to divorce their experience of the COVID-19 pandemic from the racial health disparities and the transnational reckoning with police brutality against Black people. News broadcasts with statistics from the Center for Disease Control show Black people have higher rates of COVID-19 infections, hospitalizations, and deaths than white individuals. This social fact shaped my interlocutors' anxieties about getting infected. While the catalytic police killings of Ahmaud Arbery, Breonna Taylor, and George Floyd occurred in the United States, the impact of their deaths reverberated around the globe with Black Lives Matter protests in thousands of cities where, in many instances, police violence against people of color is equally pervasive. Together, the two global crises comprise what I call a double pandemic, which contributed to my interlocutors' mental health challenges and experiences of multiple forms of marginalization. The double pandemic affected the participants' mental health in significant ways, producing symptoms of suicidality, panic attacks, depression, anxiety, and psychosomatic symptoms that aggravated other pre-existing conditions such as diabetes and heart disease. Sadie, an industrious manager and grandmother, had an unwelcome confrontation with law enforcement during a wellness check. Her experience illustrates the ways in which Black people with mental illness have experienced the double pandemic. Concerned about her worsening suicidal ideation, white members of a support group she attended contacted a mental health support team to check on her. The support group members did this without regard for the risks this would pose for a Black person, since police are usually the first responders at wellness checks. Unequipped to de-escalate mental health emergencies, police presence is likely to result in the injury or death of the person in crisis. Many of the slain Black people whose names have become hashtags, including Sandra Bland, Tanisha Anderson, Deborah Danner, Ezell Ford, and Walter Wallace Jr. all lived with mental illness and were either shot during a wellness check while they were in psychiatric crisis or died in police custody. Cognizant of this, Sadie states, "I was pleasant with the police officers, but they remained with their hands on their guns the whole time. And because I had a nephew here who's Black, I didn't want anything to happen to him. Because he started coming out to my aid, I went with the offers voluntarily because I didn't want," and Sadie trails off, omitting the possible outcome of her nephew's death at the hands of the police. As a result of the inhumane treatment of Black people with mental illness by law enforcement, my interlocutors present a central question for conceptualizing revolutionary futurities. That is, how do we create a world in which mental illness is not stigmatized or a death sentence for Black people? My interlocutors answer this question from a number of angles. Joshua, who works in public policy and advocacy at an international mental health organization, is working towards implementing local community-based crisis response programs that do not involve police as first responders, but rather employ peers with lived experience who can offer compassionate support and critical sensitivity to the nuances of each case. Working at the same organization as Joshua, Casey, the support group manager, started a Black mental health support group in March at the outset of the COVID-19 outbreak. Despite initial pushback from her white coworkers, the virtual support group made its debut supported by a celebrity grant, providing an important peer-led mental health resource for Black individuals who were cloistered in their homes. Claiming their diagnoses by attending biweekly Zoom meetings to commune with folk who share similar experiences, Black people with mental illness created social bonds across ages, genders, and state lines. Participants shared tips to manage triggers and symptoms, traded notes about medications and telemedicine providers, and commiserated over the casualties of the double pandemic. Most notably, the group transformed the people who attended. The safe space eased the dehumanizing effects of stigma and discrimination and celebrated the participants' resilience and survival under excruciating circumstances. So Joshua and Casey's approach to Black futurity is in line with the slogan presented in this image, "Nothing about us without us is for us," which comes from the psychiatric survivor, ex-patient consumer movement and the mental health peer movement of the civil rights era. When I ask Luna, a doula and midwifery student, how she envisions a better future, she shares that she dreams of a time when Black people are no longer under constant threat and instead they are given the tools to thrive. Of the police, she says, "First of all, I want the pigs to stop killing us. Second, I hope that everything that we're doing, the resistance, the revolution, is moving towards something." In New York State, Black birthing women have been dying at 8 to 12 times the rate of white birthing women. By cutting off labor support of partners and doulas from birthing people, COVID-19 hospital restrictions have done more harm to Black mothers and birthing people, making them especially at risk for postpartum mood disorders and anxiety disorders, with the increased likelihood that their symptoms will go untreated. Therefore, Luna wishes no Black birthing person dies at the hands of the medical industrial complex, and postpartum people are given more support to recover physically and psychologically. This mural here was painted in honor of Shayeja Semple, a Black woman who died during childbirth last summer. Olamina, a dancer, teacher, and doula, envisions a future where Black people are recognized in their full humanity. She conveys her experience of the double pandemic while she grieved the loss of one of her best friends. She felt dehumanized by her experience of white allyship while she mourned her friend. Olamina experienced and expressed frustration at the sudden awakening of non-Black people who joined Black Lives Matter protests and began reaching out to Black people in their networks in recognition of their plight. With Black people having always endured violence and discrimination, she found these new eager allies patronizing. Their activism and sudden interest in how she was coping with the deaths of George Floyd and Breonna Taylor overlooked her personal grief, her small grief, as she terms it, the loss of a loved one, a grief common to all humans regardless of race. By giving greater weight to her big grief, universal Black oppression, white allies disregarded Olamina's humanity and reinforced their own racism. Thus, Olamina envisions a future where the small grief of Black life can be attended to, and not just the big grief that galvanizes the often temporary support of white allies. Discussing her experience of teletherapy and telepsychiatry, Sadie saw the benefits of virtual mental health care. In addition to the convenience of skipping the commute and time spent in the waiting room, for Sadie, remote care reduces the stigma of mental illness. Although the conditions of quarantine may induce mental illness, now people have different avenues, she says, for addressing their issues, be it through telemedicine, teletherapy, online support groups, etc. While these new options for mental health care can provide more anonymity, since people do not need to be seen in person at an office, Sadie observes that more people are actually claiming mental health issues publicly. She emphasizes the right people are saying that they have mental health issues, and society is benefiting as a result. This has been an unexpected benefit of an otherwise devastating time. Of her unemployment experience, Olamina remarks, "The CARES Act, which granted stimulus checks and unemployment benefits, didn't make things better. But because I was doing far less for the first few months of quarantine, I was saving way more money, even though I was paying for rent for an apartment I wasn't in. I wasn't eating out, I wasn't getting on the subway. It's so weird when you realize it costs me more to live and work than it is to just live." Willow also attests to the fact that her mental health improved while she was unemployed during the pandemic. The support from unemployment insurance enabled her to fine-tune her self-care practices, teletherapy, and medication management, and now she feels more confident about returning to work. With greater self-knowledge and an ability to center herself through exercise, yoga, meditation, and a microdosing practice, Willow feels more self-assured in asking for accommodations to take time off work instead of quitting outright like she usually does when she gets overwhelmed. Disability and animal rights activist, artist, and scholar Sonura Taylor aptly conveys the political implications of Willow and Olamina's sentiments about work. Taylor declares, the right not to work is the right not to have your value determined by your productivity as a worker, by your employability, or salary. Critiquing capitalism, Taylor argues that people with disabilities have been indoctrinated to fetishize work, romanticize career, and to see the performance of wage labor as the ultimate freedom. As Olamina and Willow experience the positive effects of unemployment on their mental health and financial security, they became capable of appreciating their intrinsic value by simply existing. Their temporary pandemic-induced circumstances potentially enable them to practice more liberatory forms of care that Taylor envisions. However, once the pandemic is over, the question remains, how can people with psychiatric disabilities continue to thrive if they do not want to participate in the capitalist work economy? Once the COVID-19 pandemic has passed, hopefully we will have gained more awareness as a society about the needs of people with mental health challenges. Ideally, tools such as telemedicine and technologies for remote work will continue to be used to accommodate people's various access needs. In a perfect post-pandemic future, we would implement systems of care that ensure all people who are unable to work are supported with secure housing and financial stability. Hopefully, the attention to mental health will inspire more public dialogue to destigmatize mental illness and combat police brutality. In conclusion, today, I've provided a glimpse into the Black experience with mental health during the double pandemic that continues even now. The issues my respondents raised have extensive implications for grasping the intersectional complexity needed to enact revolutionary futurities. As I count myself among my interlocutors as a Black person with lived experience of psychiatric disability, I can say that our collective visions of futurity not only recognize that Black lives matter, but also nourish, support, and celebrate Black lives and Black minds. Thank you for listening.
Thank you very much, Nadia. That was fantastic. Okay, so thank you for that. Without further ado, I will hand over to our next speaker. Give me 1 second to bring up the spotlights. Okay, so I'd like to welcome Lois Liao, and the title of the presentation is Do You See What I See? Applying Pierre Bourdieu's theories to the intersectional research of social class, race, and mental health. So over to you, Lois.
Thank you very much, Ed, and thank you so much, Nadia, for the very touching presentation. So my name is Lois Liao. I'm currently a fellow at London School of Economics. So this morning, I actually looked into the mirror. I imagine many of you do in the morning too. And I think I really need a haircut. That's probably a shared experience amongst many of you at the moment. But I used to look into the mirror and all I can see was someone who's looking very ugly. And that might also be a shared experience amongst some of you in the audience. But where did that definition of ugliness come from? And what kind of benchmark was I assessing myself against? So I hope to answer these two questions in the next 15 minutes by taking you through my very personal journey. And I will also talk about how the role that my Chineseness played in this journey. So as someone who works a lot with economists, the concept of capital is not foreign to many of my colleagues. Many of us, when we think about capital, we think about economic capital. Economic capital is defined by the quantity and security of your income and of your wealth. But the concept capital can be extended to other things that we own. So these are my parents. They had enough economic capital to send me to study in the UK. They also had some cultural capital. Cultural capital is defined by the universities that you went to, the subjects you study, as well as informal possession of cultural assets. For example, your taste of music, your taste of art. My parents have never been to the UK before they sent me to the UK. As a result, much of their cultural capital was in the Chinese context. And for me, as someone who was born to them, grew up with them, I listened to what they listened to, I read what they read, and I also gained my own cultural capital by attending schools. But the schools that I've attended all the way until I came to the UK were local Chinese schools. As a result, similar to my parents, most of my cultural capital was also in the Chinese context. As a result, as I came to the UK, much of this cultural capital became irrelevant. I feel a little bit awkward when I arrived, and I didn't really feel for the social game. In informal conversations, I didn't really know where to place myself, how to carry myself, where to look, what to talk about, how to even make small talks. And I also realized that I lacked cultural capital, which is the ones recognized by the mainstream society. I wasn't able to write references to music. I didn't know who Coldplay was. I didn't know much about the history, the arts, and even in my formal education, very simple common sense questions would make me struggle. I also realized that I lacked social capital. During Parents' Days, I realized that many of the other parents got along so well, and the parents and the teachers also got along really well. Often they came from very similar social class, social background. They went to school together, they do business together, they even go ski together during Christmas. Whilst I was there by myself, my parents not being around. And to be honest, I think even if my parents were there, it wouldn't make much difference anyways, because they didn't speak very good English and they shared very little with all these parents or these teachers. I also realized that I lack something called symbolic capital. Symbolic capital refers to the resources that are related to pride, honor, and prestige. For example, in the context of UK, someone who went to Eton College may be regarded as someone who has a symbolic capital to become Conservative Party leader. When I looked at myself whilst listening to the other peers talking about their ancestries, me or my parents have done nothing which is regarded as a valid form of symbolic capital. I felt very out of place in that environment. Although up to this moment, everything was a battle in my head, but this battle in my head was quickly reinforced in the form of body. The body is the first thing that we see when we encounter others, and it's also the first thing that we display to others when we make contact with others or communicate with others. My sense of inadequacy or lack of self-worth was manifested in the way that I looked at the ideal body shape. When I looked at mainstream media or the popular beliefs portrayed by my peers, this ideal body shape was something blonde, Caucasian, sexy, slim, whilst busty. And when I looked at myself into the mirror, look at my Asian body, it looked nothing like that. When I assessed my own self against this ideal standard, I failed every single criteria. As a result, I felt a sense of bankruptcy on my self-worth. And I also used the body to try to resolve this tension both in terms of my feeling of lack of value and not feel fit in the social game. For example, in the process of trying to lose weight to become slimmer, I developed eating disorder. I also try to look more Caucasian by dyeing my hair blonde, hoping that will bring me happiness by moving closer to this ideal standards. But these things didn't make me happy at all. I was constantly trying to fit myself into other people's shoes, the shoes that were made for someone else, not myself. Then I started to seek for help. I first spoke to my housemaster, who referred me to the reverend of the school, who told me that I was sad because I lacked faith. At that time, I thought religion was something ritualistic. As a result, that meeting wasn't very fruitful for me. And it wasn't until my first year in university, I started to see my GP, who recommended me to go on medication. But that encountered a lot of obstacles from my mom, because at that time, mental health was still a taboo for Chinese community, and is often labeled as something shameful. I later reached out for other forms of help, for example, by going to talking therapies, which typically put me on cognitive behavioral therapy or acceptance and commitment therapy. I also started meditation and doing yoga. So all these things helped a lot to a certain extent. But one thing I realized is that during or throughout my recovery journey, all the mechanisms recommended to me to elevate my pain focused on individual responsibility. It was me, myself, need to be responsible for why I got to where I am. And it should be myself to alleviate myself from that sense of feeling trapped. But the whole discussion of how the society structure, the system impact on this subjective feeling, how individuals can internalize what's happening around them is rarely discussed or even mentioned to me. I wasn't able to make sense of my journey or my story at that time, but it was later on when I discovered the theories of Pierre Bourdieu, which made me realize that individual agency matters, and so is our understanding of the structure. So who is Pierre Bourdieu? Bourdieu is a French sociologist and philosopher, and much of his own theories is stemmed from his personal tug of war between his working class background and his very elitist education. So he was born to a postal worker family in rural France, but he attended various prestigious schools in the country. The equivalent would be studying at Eton first, then go on to study PPE at Oxford. He constantly felt not being able to fit in that environment, even though he had the right grades to be with these people who he was studying with. He talked about 4 forms of capital, which we briefly talked about when I was talking about my journey, which are economic, social, symbolic, and cultural capitals. And he also talked about something called habitus. When we grow up, we have our early family education as well as our early education. We learned a set of social rules because of these early environment that we were in. And these internalized rules is also linked to what kind of capital that our parents had. As a result, we developed these embedded ways of viewing the world and viewing ourselves. So for example, a footballer would learn a set of rules to play the football game. As a result, he would internalize that rules. And when he goes to a football game, he will know when to strike the ball or when to pass the ball. But you may also have the wrong habitus in a particular social game. For example, if a rugby player enters into a social game, a football game, he may not have the feel for the game because the rules that he internalized were the rugby rules. As a result, he will feel very uneasy in the football field. Therefore, the habitus and capital, they do not act alone. We as people, we carry our embedded habitus and we carry our capital. And it is when we enter this field of social game that our behavior, our practice occur. Bourdieu defined social class based on the quantity, quality forms of different capital. And within each social class, there is a shared experience. Bourdieu's understanding of social class differs greatly from Marx's understanding of social class. For Marx, much of the struggle within social classes is economic. But as we've seen from Bourdieu's theory, that struggle goes beyond economic struggle. It is also symbolic, cultural, and social. In particular, that symbolic dimension really sets him apart from Marx's understanding of social class. So how does this all link to the living experience of ethnic minority and mental health? The ethnic minorities, to a certain degree, do not have the recognized forms of capital. It could be symbolic, cultural, social, and sometimes economic. In a post-colonial country, race itself can also be viewed as a form of a symbolic capital. Because of the ethnic minorities' background growing up, they may not have the feel for the social game. They may not have the right habitus, the right behavior or disposition to engage with mainstream society. And that experience of feeling unfit can extend to the time when they access mental health services. Things like talking therapies may not be very accessible for people who did not grow up in an English-speaking background. The second route that we may take for future research is the role of the physical body. As much as we typically have the tendency of separating the mind from the body, the ethnic minority body look very different to the ethnic majority body. And as the body is the first thing that we see when I see a person, this body becomes not only a battlefield of our attention, but also a display board of our intellectual and our thoughts. And both can come out very vividly during the time like COVID, because on normal days, the ethnic minority may have internalized much of this unequal treatments or the unfit of the game as part of the rules of the society. But it is unprecedented events like the COVID, which brought this living experience live and to the foreground. I would like to share a story by one of my interviewees called Tom. Tom is a Chinese ethnic minority, but he was originally from a Southeast Asian country. He has been in the UK to study since his secondary school, and now he's studying towards his master's degree. During the spare time, Tom enjoys running in Regent's Park. But one day when he was running, he encountered someone who threw some racial comments to him and followed by a punch. As someone who's of Chinese ethnic minority, Tom is associated to the Chinese people, where people at the beginning of the pandemic, people thought the virus came from China. Even though he did not live in China, he's not a Chinese passport holder, it is very hard for others to distinguish that just by looking at his body. And the symbolic capital that he has was further reduced during the COVID time. And the symbolic violence can be turned into a physical violence. When Tom woke up after feeling unconscious for a while, someone offered him some help. But he rejected the person's help, pretending to be okay. And he told me that he did so because he felt unsafe because of COVID. He also stopped going to school because of both the worry of safety for his race and COVID, as well as stopped running. And that further increased his feeling of isolation and helplessness. Ethnicity is something that Tom is constantly reminded of, voluntarily and involuntarily. Voluntarily, he is proud of his Chinese heritage and affiliation to Chinese culture, but the involuntary reminder came from, for example, a punch or some comments on Twitter or in the media. And even at home, in his home country, there is political instability over there, where he is also ethnic minority there. And all of this experience made him feel like wherever I go, I feel like a foreigner. And this feeling of unwantedness and feeling trapped is exacerbated because of different travel restraints and travel bans. So now we zoom out Tom's story, we zoom out COVID, and we even zoom out the living experience of the Chinese ethnic minority group. And I would like to point out what kind of future direction we can take in studying race, ethnicity, social class, and mental health. We need intersectional study for all of these areas. And if possible, the dimension of gender is also very important in this aspect. Bourdieu himself didn't talk much about race and ethnicity, but as we've seen, this is a very important dimension when we try to understand the living experience of social classes. And second, we need to expand Bourdieu's theories to talk more about resistance and so what. As I have illustrated during my own personal journey, or perhaps that's a lot of you have encountered, many of the current social policies as well as mental health policies focused on framing the individual responsibility. As a result, even if the tools of recovery is available there and you are not recovered, you are subject to a second violence because of the blame from the other parts of society. But as we've seen from Bourdieu's theories, individual agency is very important. So is the understanding of what is going on outside of us, the structure and the system. And this therefore forms a resistance to the current social policies, which purely emphasize on individual responsibilities. And we also need to talk about so what. Some of Bourdieu's theories are very deterministic, especially when we talk about the reproduction of social class, as well as things like habitus. They seem to be much determined before you were even conscious about your own situation. But is that really the case? Bourdieu didn't talk much about how to liberate ourselves from our personal conditions, but this is in the hands of us and in the hands of our future researchers. And finally, which is also another limitation of Bourdieu's research, he didn't talk much about using the living experience. To the social scientists, they still know more about the lives of the subjects that they study than the subjects themselves. But as Bourdieu, as well as myself, have illustrated, much of what the social scientists cared about often came from their own backgrounds and is often limited by their own experiences. As a result, I would like to thank everyone who came to this panel to engage in this two-way conversation, because this is a living experience and it is our experience. Thank you very much.
Thank you so much, Lois. That was fantastic. That was really, really interesting, and lots of links there with the topics that were discussed in Nadia's presentation as well. Okay, so lastly, I'd like to hand over to Dr. Joy Rooney, who is going to be our final speaker. I'd like to remind everyone in the meantime, we will be opening the chat once Joy's presentation is finished, but before that, please do leave any questions or any comments that you have for our speakers on the Padlet, and I've put the link in the chat. Okay, so Joy's presentation, along with Peter Unwin, the title is Effects of COVID-19 on the Mental Health of a University-Based Group of Service Users and Carers. Over to you, Joy. Joy, sorry, Joy, you're still on mute.
Sorry. Thank you all. Ed, CRASSH, the steering group, Dr. Lois, two very interesting speakers, and for the privilege of being able to speak to you today about our research at the University of Worcester. The evidence base as yet is limited in this form of research. For example, Berger et al. From BMJ editorial suggests the risks of COVID-19, like those associated with many acute and chronic health conditions, are heterogeneous and may disproportionately affect vulnerable populations. In addition, Umaku and Lee in the Rehabilitation Psychology Journal suggest perceived stress related to COVID-19 was positively associated with coping strategies, including self-distraction, denial, substance use, behavioural disengagement, venting, planning, religion, and self-blame for those with disabilities and chronic conditions. Most recently, last week, Epstein et al., who are service users and carers, in the Disability and Health Journal, compared 6 classes of disability and the effects of COVID-19 on these people. The Shaping Our Lives report of 2020, Behind Closed Doors, the long-term impacts of COVID-19 on independent living for deaf and disabled people, suggests loss of confidence to live independently and leave home, loss of independent living skills, including mobility skills, loneliness and isolation due to postponement or inaccessibility of usual support networks, and impacts on health and well-being due to the cancellation of operations and treatments. Here at the University of Worcester, the impact group of service users and carers, or SUACs, has a number of work streams: the selection of students and staff, teaching, learning and assessment, quality and revalidation, and research. And it's some of our research that we're talking about today. The impact group range of disabilities and comorbidities include mental distress survivors, sensory disabilities such as hearing and sight, physical disabilities such as wheelchair users, cerebral palsy and age-related conditions, chronic conditions such as cancer and stroke survivors, people with learning disabilities, and carers of people with the above disabilities. This study was approved by the Ethics Committee at the University of Worcester. Invitations to impact members to participate, an information form was circulated and consent form was completed by each of them. There was an online survey of 18 participants yet to be analysed. There were 16 recorded telephone semi-structured interviews of between 30 and 75 minutes of volunteer impact members using a script. Verbatim transcriptions was made into anonymous Word documents. Semi-quantitative and thematic analysis was carried out using the methods of Rooney et al., that's me, 2016 and 2020. The semi-structured interview questions that I asked the 16 participants were, during this time of first lockdown in the UK, do you consider your mental health has changed, and if so, in what ways? And during the discourse, I also inquired, do you identify as a service user and carer with expertise in mental health due to lived experience? What are you doing to alleviate being forced to spend more time at home? Do you use any social media, and how have you kept in touch with others during lockdown? Have you taken on any new roles, developed new skills as a result of lockdown? Do you believe you will experience long-term effects as a result of COVID-19, even if you do not catch this virus? If so, in what ways? Will you make any lasting changes to your life for the future? What plans are you making to celebrate your ability to move around more freely sometime in the future? And as I say, this was during the first lockdown in the UK, which finished on the 1st of June 2020.
Okay, Joy, I'll take over from here. Thanks very much. The snapshot of the findings then. We did find some considerable differences in the coping strategies between members of our group who identified themselves as having mental distress and people who didn't. And as you'll see from the results we're going to briefly flash up here, much of their experience is quite different to people who didn't identify as being having backgrounds of mental distress. In terms of volunteering, for example, telephone support for charities, out of the group of people who identified as having mental distress, nobody looked to really be taking on proactive volunteering opportunities, whereas 83% of people who hadn't got a mental distress background saw this as something they could potentially do. So a positive opportunity. In terms of regular physical exercise, again, 30% of the identifiers thought that they would do this. Be interesting when we run this again, as we plan to do, how this has gone. 83% of people who didn't have mental distress did think they would do this, and there could be issues there about lack of confidence, self-esteem, possibly picking up on some of Lois's issues about the ideal jogger who jogs around the park. It's not me, for sure. And the third one here, all of the people who identified as having mental distress were using more online media platforms, as opposed to 43% of people who perhaps were occupying themselves in other ways. In terms of loss and readjustment, there were some feelings that those who suffered more with mental distress they experienced quite marked differences between people who didn't. For example, feelings of isolation. 50% of our members experienced that, as opposed to 33% of people who didn't have a mental health background. Anxiety, 60% of people clearly noted anxiety as a readjustment, more anxiety. The general awareness, the overwhelming worry night and day about COVID-19, this spectre on your shoulder, 50%, half of people with mental distress backgrounds felt this, far more so than the 70% who didn't. General feelings of frustration. Perhaps, people had managed to get some kind of lifestyle together that had benefits about it, despite a mental health backdrop, but much of that was frustrated by the strictures of COVID. And again, only 7% of people without mental health issues felt that. Generic concern about themselves, their communities, the world, 40% of people noted this as an area of loss and readjustment. Feelings of being locked up, and this was interesting. One or two people in particular harking back to when they were compulsorily detained in mental health institutions, being told what to do, unable to go here, unable to go there. Very interesting how this evoked very negative feelings of state control, really. General strangeness, 30% of our members just reported feeling strange in these times, whereas people without mental health histories didn't. The impending sense of doom, which is kind of a bit more serious than the concern, a doom, the end is nigh, where will this all end? There is no future. 20%, a fifth of our people, as opposed to nobody, particularly in the more generic disabled and caring group. And issues of panic. Again, a fifth of people, significant difference in readjusting, panicking about what's going to happen next. In terms of re-evaluating their lives, trying to, find some kind of silver lining in all this horror, as one or two people have looked at already this afternoon. Planning ahead. Now let's have some contingency plans about health and care needs, wills, power of attorney, those kind of issues. 30% of people with mental health backgrounds thought, well, we could probably get our affairs in order. 30%, possibly due to the predomination of concern, and that this perhaps isn't going to get better very quickly. Remember, this was the early days. This was a June time, as opposed to 17% of people who didn't particularly start to worry about the future. 20% of people thought it was impossible to reevaluate the lights because this phenomenon in our midst was so uncertain. It's a lot more certain now, but for some people it's still very uncertain. The importance of relationships. 20% of people with a mental health distress background were re-evaluating the importance of kith and kin, friends, family, as opposed to a third of people, 33% of people without mental health backgrounds. And that may be something to do with people who have significant mental health backgrounds. Is it chicken or egg? Do relationships become more important because you haven't got any? Or is it that you think more about the ones you've got and perhaps you neglect when we're so busy going about our general pre-COVID lives? Interesting, becoming less materialistic. What is important? And again, people with mental health issues, perhaps people who think more, ruminate more about issues, or even kind of more fatalistic, perhaps, about things, what's important, what isn't. Why are we so materialistic? And a significant number there thinking we should be less materialistic and concentrate more on things such as the importance of relationships. Travel, this has been an interesting one, hasn't it, for those of us who have felt hemmed in. Travel outside the UK, a fifth of people hoping to do that back in June, and those hopes haven't particularly been come to fruition yet, have they? Whereas people without the mental health backdrop hadn't particularly identified travel as something they wanted to do, and were perhaps more optimistic. Buying a motorbike or a car, 20%. Obviously, there's a couple of people there wanting to offset the green benefits of COVID. And carpe diem, seizing the day. 10% of our colleagues with mental health backgrounds thought that, I could get hold of a few things, I could make a difference. Whereas 17% of people without mental health backgrounds did think that they would seize the day. So perhaps a more pessimistic view from people with mental health about, well, can any good come of this? Can we seize opportunities? And the last one there again, walking, shopping more locally, 10% from identifiers and 17% from people who didn't identify as having a mental health background. And all of our participants in our impact group have a range of health and social care contact, as Joy mentioned early on, and they all saw, all those that were dependent in some way or other, saw quality of life diminish in those first few months of the pandemic. Limited contact with GPs, still going on to some extent. Cancellation of all NHS appointments. We're beginning to see the outcomes of that, aren't we, now, in various issues such as cancer and what have you. Difficulties obtaining prescriptions and food when shielding, particularly if you have a very limited social network. And at least 4 of our members were shielding. A genuine worry about, well, who will get my prescription? Who will get my food? Rather than having friends and family to call on. And the cancellation of respite and social care, particularly impacting on carers, particularly maybe carers of severely disabled children. Feelings that the world will change. Most service users and carers believed that there would be a long-term effect on their lives, even if they didn't get COVID. And this, of course, was before the huge number of deaths mounted up. People with a slight disability, loss of confidence, anxious, panicky about going to shops due to social distancing, and not being able to see directions. If you've got a visual impairment or cognitive impairment, lots of these distances, I did it myself just the other day. Am I doing it right? Am I following the right instructions? But in terms of some celebration at the end of the first lockdown period there, 80% of identifiers compared to 100% of non-identifiers celebrating with families and friends, looking forward to this. 20% either had a plan or feeling too negative to contemplate a plan. Travel and holidays again, looking forward to that, 83% and 80%. Going out for meals and meet-ups at coffee shops, 67% for non-identifiers or 20% for identifiers. Again, that could reflect the reality of the social networks of some people who have significant mental distress histories. We as a university, and there is a great role for universities, particularly as many charities and voluntary orgs have gone to the wall, we did our best to keep support going, weekly Zoom, wellbeing, planning, meetings. We quickly learned how people could phone in if they haven't got the IT, the digital poverty, and we had much more regular email contact and telephone contact with myself. So we did do our best from a distance to try and be authentic in supporting our colleagues and not just pulling the plug, as it were, recognizing that we are a form of significant form of support. So this piece of work we've done, which we're going to repeat, the first report of COVID's effect on a group working in higher education of users and carers. It distinguished people with mental distress backgrounds from others, and many of the works on service users and carers don't do that. And it's made us think more deeply about perhaps how we do run things. We have a lot of information still to mine, including the survey information, and we do intend to run this again. It's back at ethics now for a reapproval, so we can do some kind of comparative study a year on what lessons we can learn from this. Hopefully never to be repeated in the future, but there we are. We think it's interesting, it's qualitative, it's small scale, but we think there's messages in there, and that's just our contact details. So thank you very much, and I think questions come at the end, don't they, Ed?
Yes, that's right. Thank you so much, Peter and Joy, for that. That was, again, another really, really interesting talk, and you know, lots of shared themes that we can get into in the next bit. So we're going to just very, very quickly. We're just going to very, very quickly now open up the chat. And firstly, I just want to kind of ask everyone to respond to the questions that we set up at the very start. Just thinking across all three of the presentations, and you can either respond in the Zoom chat or you can go to our Padlet. Firstly, thinking of all three of these presentations, what are the main lessons for mental health services and for mental health service providers that we should take away from these three talks? So I'm just going to give everyone sort of a minute or so to write some sort of response either into the Zoom chat or into the Padlet. The other thing I'd say is that there's no pressure to respond now. We're also going to be sending out a response form to everyone who's joined today, and you can also add in a response at a later stage as well. Okay, so the first question we had was around lessons for mental health services. The second is lessons for activists. What should activists take away from these three presentations? And the next is lessons for government and politicians. And the final sort of category that we want to have thoughts on is lessons for researchers. So again, we'll just give everyone another couple of minutes to put their responses in, and then we'll open up to some questions. Okay, thanks for those responses, everyone, and do keep them coming in. So firstly, we just want to give an opportunity for anyone who might be joining with maybe a visual impairment, somebody who might be joining over the phone. If you want to ask a question and you're not able to participate in the chat or on the Padlet, feel free to unmute now and ask a question if you'd like to. Okay, in that case, I'm going to go to the first question that's come in on the Padlet. This is a question for Lois, and it's about Bourdieu's theory. You mentioned the importance of personal agency in Bourdieu's theory of as applied to mental health programs and research. However, as I know, all Bourdieu's theories do not really respect individual agency. Could you elaborate more on this point?
Yeah, that's a very great question, and it links to what we were talking about for future research as well. To me, Bourdieu talks definitely more about the structure and how structure impacts individual paths in life than individual agency. But he did defend himself, saying that individuals have margin of freedom in his later book, Pascalian Meditations. The question for us is how do we combine and use both our individual agency and the reforms of the system to change the living experience of people of the minorities or the marginalized groups or of mental health users. So I would say that actually linked to what Nadia and Peter have presented. So Nadia, you talked a lot about the impact on the system, the external events, whilst Peter, you also talk about how the subjective feelings differed for people who had or had not have mental health issues. So this is where we should head to for the future research. Yeah, thank you very much.
Thank you, Lois. I should add as well, if anyone does want to ask a question, you can also raise your hand in the meeting as well. The next question is written to Lois, but I think it can actually apply to a number of the speakers on the panel. How has your own recovery experience or lived experience shaped your research, and how has it changed your perspective? So yeah, who might like to come in on that?
I can share.
Yeah, if that's all right.
Yeah, so part of my lived experience, which I'm very comfortable in sharing, is that I have a diagnosis of bipolar disorder. And when I received this diagnosis when I was 18, the first thing that came into my mind is I'm going to be a terrible mother. And it took many years of, going to school and then starting my PhD to realize the eugenic and racist discourse around motherhood and mental illness that actually affected the way that I was self-stigmatizing. And it was through my own experience of giving birth to my daughter that I encountered, not only is there a crisis that I explained with Black maternal mortality in the United States, but what I discovered is that mental health is one of the leading complications of pregnancy and postpartum that can actually lead to mortality and morbidity. So through my own embodied experience of having to deal with a broken mental health system, a system in which I have to encounter police in order to get help, where there isn't good quality care and it's very racially divided when it comes to maternal care, and there's no real understanding of reproductive psychiatry either. people have to really navigate things on their own. And I was very lucky that I was trained as a doula to, you know, walk people through the process of birth and postpartum. And I ended up doulaing myself and also being a mental health doula to myself. And now my experience, not only just living with bipolar disorder, but also the lived experience of pregnancy and postpartum with bipolar disorder and motherhood, is something that I am taking into my research for my dissertation project.
Thanks very much, Nadia. Joy, do you want to come in next?
I was very fortunate after my first degree to go into scientific research, despite spending a lot of time on acute psychiatric wards. I don't believe in mental health diagnoses, so I'm not going to give you one. I was fortunate enough to be able to do that for 16 years, tenured, before I was made redundant. And I've come to humanities research much later in life, although I've had very many years of being a revolving door patient. And I use my lived experience in the NHS at the moment to deliver psychosocial education courses for people with severe and enduring mental health distress as a peer support worker within Worcestershire Recovery Services. But what I found as far as research is concerned, and research in humanities, is how wonderful it is to come across a group of people with lived experience in the impact group of service users and carers, who often are professionals by background, social workers, probation officers, or service user and carer consultants, who together try and make a difference to the lives of those people that experience social and healthcare services, and that Peter Unwin and I, since 2016, have been able to report on that in the academic literature, and it's a great support network as well. Thank you.
Thank you. And Lois, can we come to you next?
Yeah, I think my life experience can be summed up as always feel like an outsider. I think even today, wherever I go, I still feel the same. And because of that angle, I keep on asking myself, why do I feel like outsider? Why do I feel being marginalized? And I try to understand what kind of standards was myself or the society assessing each other against. And I think that formed a very important direction for my research. So my PhD looked at people living in social housing, and for people living in social housing, the poverty is the poverty in terms of housing assets is something very unique in a country which pursued home ownership, for example. So this feeling of being outsider constantly drive me to understand what divides us. And later on, I start to embrace that diversity is a very important thing, not just in terms of race, gender, but also in terms of how you want to live your life. There isn't a one way of living your life. There is your way of living your life. And then it was a relief that I no longer assess myself. I no longer look into the mirror of thinking about that very perfect body shape. Yeah.
Thank you very much. So the next question has come in via the chat. This is from Tom. Can I raise the question of money and financial problems and the consequences of going into debt? So I assume this is in the context of mental health and COVID-19, not just the cancellation or avoidance of social care, but also general increased costs and charges. So yeah, does anyone want to kind of come in on this question of money, financial problems, debt? Peter, shall I come to you?
Well, as you're aware, the government have put some strategies into place, so they've had to have their arm twisted up the back about the extension of universal credit, £20 extra bit of money. And Nadia, I think, mentioned that in the States they'd also done some similar type of handout as it were, some benefits. I'm not quite sure how it works over there, if it is a benefit or if it's just for people, it supplements their work, like the furlough scheme. So I think I don't want to be an apologist for the Conservative government, but I think they have made some steps towards trying to ensure at least people can keep body and soul together. It's never enough. I mean, the massive costs of COVID to the economy, and I think it's interesting that we're all the media seem to be rejoicing about the economy's getting better. The economy, as if we haven't in fact learned from the COVID that in fact what's important is each other and relationships and looking after mental health, despite mental health having become so well profiled with Rashford and people in the UK. We haven't learned that. We're raving about the stock markets going up again now, and how what alternative use we can put to empty office accommodation, etc., etc. So I think it's also against the context of disabled people as scroungers. There's a great book you should all read called Crippled by a woman called Frances Ryan, journalist, a disabled person herself, that talks, it was just written pre-COVID, but she's just done another edition. It's only a couple of years old with a COVID perspective on it. And she'll talk much more eloquently than I can about the lived experience of the disabled people as scroungers thing and the sanctions and the benefits, tribunals and all that nonsense. And as ever, disabled people get the rough end of the stick. And, we know how many tax fiddles go on from major corporations, etc., yet we hammer the person at the bottom. And that's often been the disabled person. That's before COVID. And it was interesting to me, Joy mentioned that editorial from the BJSW, Berger et al. 2020, that really said, why did the government basically ditch user involvement when COVID came along? Why did it say you can lessen this, you don't need to involve people in this, we'll scrap the consultation groups at GPs, etc., etc. Whereas what it should have been doing is completely the opposite, and ask disabled people with mental health, what do you think we can do as a nation to pull together? What can you call on? What are your strengths? Rather than some kind of, very demeaning, pathological throwaway view of all this year's work we've done, all the decades we've done to try and get the user voice raised as a credible body of knowledge and resource alongside academic, professional and political knowledge. So a real mixed bag, I think. And it's fantastic that we've got this is the times of COVID, we've got 75% of people with lived experience networking at this event. I mean, there's a real strength. There's some capital there, Lois, isn't there? Yeah.
Joy, I see you put your hand up. I might just come to Nadia first, if that's all right, and then come back to you. Nadia, do you want to, are you able to offer a bit of a perspective from the US?
It's very challenging in the US because we did get stimulus payments from the government, I believe 3 times, and unemployment insurance, but not everybody has access to this. It depends on how much you worked and put into the system. It also depends on your citizenship status. So if you're undocumented or don't have US citizenship, that's not available to you. So there's a lot of ways in which people can fall through the cracks, and there have been a lot of GoFundMes and mutual aid circulating so that there is a community support and community safety net. But in the cases, like I've explained, where people have gotten lucky and have gotten their unemployment insurance, maybe they're staying with a relative and they don't have to pay rent and they're receiving stimulus checks, we've seen people's health actually improve, and the ability to actually say, actually, I want to go back to work now because I'm feeling well. And I think that's just a really good example that we can, in activist work, present to politicians and the government to say that when people are taken care of, it doesn't mean that they will necessarily leave the economy, the capitalistic economy, but they will have the support to want to contribute in their own ways, in ways that is accessible for them.
Thank you very much. And Joy, if I can pass over to you quickly.
Yes, I can't give the details, but I saw an email being circulated within the NHS Learning Disability Service that I work in part-time about something to do with people that suffer with mental distress and are in debt, can do some offsetting. Perhaps I can get that to you, Ed, and you could circulate it in the future to people. I don't know, in some way. But I don't.
Yeah, we'll be emailing
I'm
after the
sorry.
session.
Thank you.
Thanks. With an eye on time, I'm not sure we'll be able to get through all of the questions, but Lois has made the suggestion that we can post the remaining questions into Padlet and share them with our speakers, and then invite our speakers to comment on them there, and then everyone can access the answers there. So if I can put everyone on the panel on the spot and check that will be okay, then we can set that up after the session. All right. Well, thanks so much for all of your questions, everyone, and thank you for joining us today. It's been a genuinely really fascinating session. It's been great to see such groundbreaking research, especially on current world events, shared here. And so thank you everyone for participating. Thank you for all of your questions. And as I said, we'll be sharing the questions in the Padlet with our panelists to give them a chance to respond to the questions we didn't get to. So in the meantime, I just want to say a big thank you to all of our panelists. So that's Nadia Mbonde, Lois Liao, Joy Rooney, and Peter Unwin. Thank you so much for joining us today. We're going to be continuing all of this week with sessions. Please do join for some more if you're able to. You can follow us on Twitter at SocialPowerMH, or you can check out our website. Just Google Social Power Mental Health, and that will bring that up. And we will continue for the rest of the week with another 7 events. Okay, so thank you everyone, and we'll end the session there.